Can you lift up your hips a little bit, dear? Okay, thank you.
Mrs. Simpson has a sigmoid colostomy with an external pouching system.
Okay.
You are going to change her pouch and review steps she is using at home for self-care.
All right, I see
As you
that
plan for
have
pouching and
on a
enterostomy,
one-piece
consider the
pouch.
following
This works really
questions.
well for me.
What is the location and condition of the patient's stoma? What is the character of fecal effluent, also known as fecal output, you would anticipate? What is the patient's usual elimination pattern? And what type of pouching system is being used, and is it effective? Mrs. Simpson has a colostomy. The pouching system she will receive is a two-piece detachable system. To minimize skin irritation, avoid unnecessary changing of the entire pouching system. Other supplies you need include a pouch closure device, such as a clamp, ostomy deodorant and paste, clean disposable gloves, clean washcloth, and skin care products such as powder, cleanser, and skin prep. A basin of warm water, scissors, tape, and an ostomy belt also may be needed.
I'm going to examine your abdomen.
Carefully assess
Okay,
the
my fingers are
abdomen
a
and
little
stoma
cold
site
on my
before you begin the procedure.
Just looking at your tummy. everything
Have your
looks
patient either in a standing or supine position.
fine. I don't see any bumps or lumps.
Auscultate the abdomen for bowel sounds. It is best to change the skin barrier and pouch at times of less fecal output. The patient will learn what works best for his or her situation.
Well, that sounds like you do have a little cramping going on, but that's why you're here, huh? Now I'm going to push a little bit, so let me know if anything hurts.
Observe the abdominal contour and the abdominal incision if present. Is the abdomen firm or flat, soft or flabby? The abdominal contour determines the proper placement of the pouch. A special pouching system is required for
Sounds a
stomas
little
that are
funny with that
retracted
bag,
or in skin folds.
Well, that seems to be all right. Okay, well, it looks like you've got a really great seal. I don't see any leakage.
Observe the skin barrier and pouch for leakage and note how long both have remained in place. If fecal contents are leaking, apply gloves for the remainder of your assessment.
Well, now I'm going to take
To begin
your
pouching,
appliance off.
wash your hands
Alrighty.
and apply a pair of disposable gloves.
And if you have any questions, be sure to ask me. I don't expect a lot to happen.
Drape the patient to expose the ostomy and protect the patient's clothing and bedding.
There we go.
Remove the used pouch and skin barrier.
It's important when you take these adhesives off that you get it started, then use your other finger to push your skin away. Don't just pull it off like a Band-Aid, because your skin has got to hold up underneath a lot of adhesives over the years. All right, now I'm going to take it all the way up. All right.
Use your critical thinking skills as you assess the condition of the stoma. Observe the stoma for color, swelling, trauma, and healing. Normally, a stoma should be moist and reddish pink. Also assess the type of stoma. If there is fecal output in the pouch, note the character and amount of effluent and record this information in the intake and output chart.
Well, your stoma is bright and red and moist, just like it's supposed to be. That is great. You do have a little redness around the outside and just around the outside of your teeth, but your skin looks really very good.
Note scars, skin folds, skin irritation or
looks
breakdown,
great. It's like
and
very
condition of the peristomal suture line, if present.
Well, now what I'm going to do is clean that up a little bit. And how do you clean it at home? What do you use?
Just soap and water.
Soap and water?
Mhm.
Well, that's great. Soap and water is fine. The important thing is to rinse off all of the soap residue.
Okay.
It can stay behind and make your skin red and sore. All I'm going to use is some warm water
Okay.
because it really doesn't need anything more than that. There are commercial spray cleaners that are safe, and you can always use those, but this is fine. Now, if you take a shower or a bath, you can get into the shower or bath with your ostomy appliance on. Should hold up for about 10 minutes.
Okay.
If you want to change it, and you know it's like the day that you're planning on changing it, it's probably a better idea in the morning after you hadn't had anything by mouth to go ahead and get up before you even brush your teeth. Take off your appliance while it's dry and get in the shower, and the water can run over your stoma. The body's always pushing things out, and that's really good for your skin.
Okay.
So you can go ahead and do that, but everything looks fine. Now, I'm going to pat that dry. And now you notice I'm not afraid to touch your stoma.
Yeah, sometimes there's a little bleeding around the stoma. Is that normal?
That's normal. I was just going to mention that. That shows that it's good and healthy because this is just like the same area is inside your mouth, only it's just farther down. And just like we make a mucus that we call spit in our mouth, that's what comes out here, only it's thicker.
Okay.
And this is beautiful, healthy stoma. That's just the way it should look. And a little bit of bleeding, it should stop just as quickly as if you were brushing your teeth and your gums bled and they stop really quickly. It should stop that quickly.
Okay.
If not, you can just put a little pressure on it with the washcloth.
Measure the stoma for the correct size of pouching system using the manufacturer's measuring guide.
Now this is 7/8, and that's just about right. And well, maybe 3/4 will do it. Oh, 3/4 is really nice. I'll tell you why. There's a little bit of skin showing, and yet it doesn't lay on top of any of the red part of your intestine. So we're not blocking anything. And yet there's some room so that as stool moves through, it can stretch a little bit, and it's got a little play in there. All right, well, now that we've decided which one really fits the best, I'm going to go ahead and mark that. So that when I take this off, I know which one we chose. All righty, well, that's great. So that's about the size of your stoma.
Okay.
Now, there's two kinds of appliances we can use. This plastic area is the same, so the pouch will fit either one. What we've got to decide is which one is better for you. This is a regular flat stoma, and part of your stoma sits up pretty nicely, and this would sit down around it and it'd be just fine. But this other side where you said it leaks sometimes, it's a little more even with your abdomen. This is called a convex flange. And the advantage of it over this flat flange is that it's like got a little bowl. And what that'll do is we'll make this opening wider. That's a starter hole in both of these. We'll make that wider. And that will push your tummy down and make your stoma sit up more regularly. And then whatever inside your stoma when it comes out will fall into the pouch instead of slipping under to the side.
Oh, okay.
Okay, so that's
Use an ostomy guide to cut the opening 1/16 to 1/8 inch larger than the stoma before removing the backing.
And if you'll notice, I'm not really concerned about how smooth a cut I make. Little bitty snips sometimes lay better into your skin.
Okay.
Okay, so now can you feel how that feels with your hands? All right. Now, if we warm it up, we can make it kind of bevel in, and it'll fit even more smoothly.
Oh. Okay.
That's called a pectin-based wafer,
Okay.
and the gel in there is made to work with the warmth. Ah, that looks really
If
good.
peristomal skin is wet, moist, or has blisters, ostomy powder can be applied prior to application of the pouch.
It's more like cornstarch, and what it does, it dries up your skin. So if your skin is wet and moist or has those blisters, this will make it nice and dry where we'll be able to get the appliance to fit a little better.
And the bag will stick with that on there.
That's a good question. That's a good question. What we need to do is dust away the excess, and where the skin is wet, the powder will grab. Where it's not, it brushes away.
Then,
Now,
Apply the skin barrier and pouch.
The backing off, and I'm going to make it a little tab here. I'm going to make a little tab to pull this off later on this side. You see, that's all we're going to do. Now, holding on to the strips on the side, I'm going to center it, push this on, and then I'm going to use my fingers to make sure it seals nicely. And now, where I made those little tears on the tabs, I can reach underneath and lay that down nice and smoothly. Come over here and lay that down nice and smooth. And now that I'm satisfied with how it looks, we can take off these extra 2 pieces.
Press the adhesive backing of the pouch or skin barrier smoothly against the skin.
But there is a product called paste, and what paste does, it's a caulking. And if where the skin is, and it's not quite laying down where I'd like it to, and I'm worried about something getting out of here and getting underneath there, I can come with a little paste and put it around the outside. This won't hurt your stoma. And you can put it on from the bottom, right on your skin, but sometimes what happens is it smears out like that and you don't get as good adhesion. Now, to make that fit just right, plain water's the best. If you've ever done any caulking, this looks familiar to you, and there it is. Well, this looks great. I'd like to go ahead and put the pouch on. Okay. Now, you can see with this pouch, since it's different from what you've been using, it's got some tabs. It's also got another tab up here. It's drainable. And what we want to do is put our fingers evenly and our thumbs. And then for you, you'd probably have to flip over about here and then do this evenly. So this ridge will sit inside of this opening right in here. All right, so you catch it. And my thumbs are touching and my fingers underneath are touching. And now you can see as I push it, there's a little bubble. And I want to be nice and sure that I get every bit of that. Sometimes you hear a snap, sometimes you don't. But then I come back and I check it. And then to really make sure that it's on, I give it a tug.
An ostomy belt can be applied to help keep the bag secure. Make sure the belt is not too tight. 2 fingers should fit comfortably, placed between the belt and the patient's skin. Fold the bottom of the drainable open-ended pouch up once using a closure device.
That's all you need. One fold up, and that's all you would need. And you push this together, and there it is. To take this apart, we would pull back on the top and open it. And that's your clamp. Some folks like to do this before
Apply
they-
non-allergenic paper tape around the pectin skin barrier in a window frame method.
You don't have to
The
do it.
tape adds additional security if the patient showers with the pouch on.
Swimming.
Although many ostomy pouches are odor-free, some patients like to add a small amount of ostomy deodorant into the pouch. Do not use home remedies, such as aspirin tablets, which can irritate the stoma. Also, do not make a hole in the pouch to release flatus. Properly dispose of soiled equipment. Then remove your gloves and wash your hands. Record your findings after the procedure. Include the amount of fecal drainage, the character of feces, the appearance and condition of the stoma in terms of color, swelling, and signs of irritation, the type of appliance used, and methods used to maintain ostomy function.